Here are 10 common first aid mistakes explained by a professional to help ensure you're providing the right care in emergencies. 1. Not calling for help first. Mistake: rushing to administer first aid without calling emergency services. Why it's a mistake. Even if you're trained in first aid, some emergencies require the expertise of medical professionals. In severe situations, time is critical, and waiting too long to call can reduce the chances of a positive outcome. What to do instead? Always call for emergency help, e.g. 911 or local emergency number, as soon as possible, especially in life-threatening situations. If you're unsure about the severity, it's better to call and get advice from an emergency dispatcher. 2. Not knowing how to perform CPR correctly. Mistake: performing CPR incorrectly, such as using inadequate pressure during chest compressions or not delivering rescue breaths correctly. Why it's a mistake. CPR can help save lives, but only if performed correctly. Inadequate compressions or improper technique can significantly reduce its effectiveness. What to do instead. If trained, follow the current guidelines for CPR. For adults, this generally means 30 chest compressions, at least 2 inches deep, followed by 2 rescue breaths. If you're not trained, perform hands-only CPR, chest compressions only, until help arrives. 3. Ignoring signs of shock. Mistake: not recognizing or responding to the symptoms of shock, such as pale skin, rapid breathing, and confusion. Why it's a mistake. Shock can cause the body to stop functioning properly, leading to organ failure or death. If left untreated, shock can rapidly worsen. What to do instead? If someone shows signs of shock, lay them flat, elevate their legs unless they have head, neck, or back injuries, and cover them with a blanket to keep warm. Avoid giving them food or water and call for emergency help immediately. 4. Using inappropriate materials for wound care. Mistake: using non-sterile cloths or materials to dress a wound. Why it's a mistake. Applying dirty or inappropriate materials can introduce bacteria, leading to infections that complicate healing and cause further health problems. What to do instead? Always use sterile dressings or clean cloths when covering a wound. If the wound is large or deep, apply pressure with a clean cloth or sterile gauze to stop bleeding and seek immediate medical help. 5. Using tourniquets improperly. Mistake: applying a tourniquet in non-life-threatening situations or without proper training. Why it's a mistake. Tourniquets are meant to stop life-threatening bleeding, typically from an extremity that cannot be controlled with direct pressure. Using one incorrectly or unnecessarily can cause more harm, such as tissue damage. What to do instead? Use a tourniquet only for severe bleeding that can't be controlled with direct pressure. Apply it above the injury site and make sure to mark the time it was applied. If you're unsure, direct pressure is often a safer option. 6. Moving an injured person too quickly. Mistake: moving someone, especially if they have suspected head, neck, or spinal injuries. Why it's a mistake. Moving a person with spinal or neck injuries can worsen their condition and increase the risk of permanent paralysis. What to do instead? Avoid moving a person with suspected spinal injury unless there's an immediate threat like fire or danger. If movement is necessary, stabilize the head and neck as much as possible while awaiting emergency responders. 7. Incorrectly treating burns. Mistake: using ice, ointments, or butter on burns. Why it's a mistake. Ice can cause additional tissue damage, and ointments or butter can trap heat in the skin, worsening the burn. What to do instead? Cool the burn under lukewarm, not cold, running water for at least 10 minutes. If running water isn't available, use a clean, cool cloth to soothe the burn. For severe burns, avoid breaking blisters and seek immediate medical attention. 8. Not recognizing heart attack symptoms. Mistake: assuming that heart attack symptoms are always dramatic, e.g. chest clutching. Why it's a mistake. Heart attack symptoms can be subtle or different from the classic signs, especially in women, older adults, and people with diabetes. What to do instead? Common symptoms include chest discomfort, shortness of breath, nausea, lightheadedness, pain in the arm, jaw, or back. If someone shows these signs, immediately call 911 and have them chew an aspirin if not allergic and if they are conscious. 9. Choking, doing the wrong thing. Mistake: trying to give food, water, or a finger sweep to someone who's choking. Why it's a mistake. If someone is choking, giving them food or liquid can make the obstruction worse. Attempting a finger sweep without proper training could push the object further down their airway. What to do instead? For someone who's choking and unable to breathe, perform the Heimlich maneuver, abdominal thrusts. For infants, use back blows and chest thrusts. If the person loses consciousness, begin CPR and call for emergency help. 10. Overusing or misusing pain medication. Mistake: giving someone pain medication, such as aspirin or ibuprofen, in certain first aid situations like head injuries or severe abdominal pain. Why it's a mistake. Certain pain medications, particularly aspirin, can thin the blood and worsen internal bleeding, especially in head injuries. Additionally, some medications can mask symptoms, making it harder to diagnose the severity of the injury. What to do instead? Unless you're sure of the injury and it's appropriate, such as for a mild headache, avoid giving pain medication. Seek professional medical advice first, particularly if the person is unconscious, has a head injury, or is showing other serious symptoms. By avoiding these common mistakes, you can make sure that you're providing the best possible care in an emergency and that you're not inadvertently making the situation worse. When in doubt, always call for professional medical help as soon as possible. Our videos are very educational, so share the video with everyone. Thanks for watching the video. If you liked the video, please subscribe our channel, like, comment, and share.